It's something that we all find hard to work at, and sometimes it's hard to do. You would think it would come naturally, but it's a skill that we really have to concentrate on, especially when we're assessing our patients. I'm talking about active listening, something that I hope that you're doing right now. Active listening plays a very important role in patient assessment. We can actually improve our patient assessment skills by becoming a better listener. After 20 plus years as a paramedic and 18 years as a pre-hospital educator, I've learned the importance of active listening not only in my professional life, but my personal life as well. To help you understand the importance of actively listening to patients as part of the physical exam, we will look at what active listening actually is and the proper way to utilize that skill. First, we'll talk about what active listening is. So what is the purpose of active listening? Well, to put it simply, it's a way to hear and understand the content and feeling of the other person's message. It conveys to the speaker that their message is important. It also confirms that their message is valuable to you. It provides an opportunity for the speaker to hear their own message through feedback. Let's talk about some ineffective listening habits we all should try to avoid. Don't let your thoughts go somewhere else, tuning out what the speaker's saying. Don't let yourself think that you know what the patient or person's going to say next. Don't be distracted by activity or sights, not listening to the speaker. Don't let your emotional response distract you from listening. Try not to think about what you're going to say next. That will come as time comes as you have the exchange. Don't concentrate on something else while you're speaking. The speaker is talking. Remember to listen to the speaker from their perspective. Some of the physical skills that we should try to have while we're listening. Face the speaker directly. We should have open posture, sitting with open arms, not crossed. Try to lean towards the speaker, and this shows involvement and shows that you have interest in what they're saying. Maintain direct eye contact. Remain relaxed. Try not to fidget. Have a non-rigid, comfortable, open stance about yourself, and try to create a relaxing and comfortable environment for the speaker. Don't interrupt the speaker. Don't divert the speaker by asking too many questions or making too many statements or observations. Don't try to fill in words or complete sentences for them. Let the speaker finish what they're trying to say. Encourage them to tell their own story. It's okay to use prompters like yes, go on, and I understand. Nod your head and show signs of attentiveness. Allow time for silence. That allows the speaker time to reflect and prepare for their next dialogue. Some reflective skills that we should use. Well, active listening, in order to be active listening, we have to reflect back on what's being said and give that back to the speaker. So we need to paraphrase what they've said to us. So accurately restate the speaker's message, but use your own language to convey that. Accurately restate your perception of the emotions of the speaker. Focus. Keep the flow of the conversation goal directed and specific. Clarify. Attempt to understand vague or confusing or unclear communication. Now that we know what active listening is, let's talk about communicating with our patients. We have to remember communication is a two-way process. There are many ways for a message to be communicated. For example, verbally, speaking and observing feedback. Non-verbally, by using body language. Understand too that everybody has their own personal space, and some people don't like you up in it. Always try to adjust your environment so it makes it possible for you to listen. Some factors that facilitate effective patient communication. Make professional and respectful introductions. Address the patient by their formal name. This will help you establish trust with the patient. Consider the environment, their modesty, their emotions, and their biological needs. And by all means, always keep patient confidentiality. Now, you may run across some barriers to communication. Don't use words or phrases that the patient does not understand. Keep technical terms to a minimum and only use them when dealing with other healthcare providers. Now, you may run across some special challenges when you're communicating with patients. You may deal with the hearing impaired, visual impaired people, people with speech impairments, non-English speaking people, patients that are developmental disabilities, terminally ill, hostile, anxious, You may run across abused patients or patients that have multiple symptoms, or you may just run across patients that are just overly talkative. So one of the things that we'll have to do sometimes is communicate with children. When we do that, you must keep the interview age appropriate. Kneel down to the child's level. Involve the parent or caregiver in the interview. Things to remember when we're communicating with the elderly. Remember that aging rates differ with the person, so don't automatically assume that the elderly are visually or hearing impaired. Give the patient time to discuss their chief complaint. And occasionally, you may need to verify the information with a family member or a caregiver as necessary. So, active listening plays a very important role in communicating with our patients. So now let's take a look at how it impacts our patient care. We have to listen to our patients. Active listening plays a very important role in the patient assessment. Evaluating patient signs and symptoms are key to reaching a definitive diagnosis. Signs are those things that we observe, and symptoms are things that patients tell us. So we have to use active listening to correctly hear and identify these signs and symptoms. In a book, The Law of Communication, written by Dr. Richard Schuttler back in 2010, he states that although there are other means to provide valuable information in patient assessment, they are not a substitute for active listening and face-to-face contact with the patient. We must actively listen to what the patient's telling us. When we're doing the patient interview and assessment, focus on what's being said. Don't be distracted. Don't try to multitask while the patient's talking. I found an interesting article at the website for Elmhurst College Learning Center. It stated that active listening is a communication process, and to be successful is an active process. In other words, we must be active participants in this communication process. In active listening, meaning and evaluation of the message must take place before the listener can respond to the speaker. Therefore, the listener is actively working while the speaker is talking. Gathering information from the patient during the patient assessment is the core of the skill. There has to be a clear understanding of what the patient is feeling to make an accurate assessment. Ask open-ended questions. This allows us to employ our active listening skills. Having the two-way communication builds rapport with the patient and demonstrates that we truly care. I also found a research article entitled Using Standardized Patients to Assess Communication Skills in Medical and Nursing Students. I found this on the Biomed website, and their information was published back in March of 2010. The article states that when assessing communication skills, in order for one of those students to receive a grade of A, they have to have excellent use of appropriate questioning styles, including effective information gathering. For example, appropriate levels of eye contact, body posture, and excellent active listening. A clear understanding and demonstrating of empathy, rapport building, and acknowledgement of emotional responses. Now that we know what active listening is and how it can positively and negatively impact our patient assessment, let's look at some of what we need to take away from this message today. Remember, practice your listening skills. Do not judge. Demonstrate kindness, compassion, and empathy. Understand that basic communication skills are essential to healthcare providers. Today I've informed you of how active listening is a very important communication skill. And it can be utilized during the patient assessment to better understand the patient's chief complaint and history. This information, along with a physical exam, should help the diagnosis and treatment of the patient. As a pre-hospital healthcare professional, patient assessment skills are essential to proper treatment and care of the patients. Active listening is a skill that needs to be practiced by all healthcare professionals. It shows professionalism and that we truly care about the patient. Thank you for actively listening to me today.